kind of skip a bigger section here because that's therapy. So I'm going to go to the next tab, getting back to my life, and then on D4. And we will go over this on discharge, but these are some of the common questions that I like to go over ahead of time because they are questions that a lot of our patients have. So when can you shower? It's usually post-op day 4 when there's no drainage from your incision. Let the soap and water run over the incision, don't scrub, and just pat dry. Again, don't scrub dry. And then on to D5, it goes into wound care. We can send dressings and tape home with you. You'll change your dressing daily until there's no drainage and then leave it open to air. If you don't have a dressing on, you still want to monitor that incision daily. Look for redness, swelling, drainage that all of a sudden would have started, just things to monitor on a daily basis. And there is a reference page on the back, so that last tab, reference, F13 and 14 will go over the surgical site infection. So just things to monitor as your incision is healing. Okay, so D6, on the top there is ice therapy. I talked about the gel packs at home already. PT will go over getting into your car. So I'm going to go into D7. Another common question is driving. When can you drive again? So the main rule with this is you have to be off your narcotics or your pain pills. You can't be driving around on these pain medications. The next thing is it all depends on which leg has been operated on. So if it's your left leg, of course, unless you have a clutch and drive with both legs, you'll be able to drive after you're off of your pain medications because you don't really need your left leg to drive. Your right leg will take a little bit longer because you want to make sure, of course, off the pain medications, make sure you have good movement in between going from the gas pedal to the brake and back to the gas pedal. So you're all adults and can kind of make that decision and how well you're moving. I've seen anybody drive from a week to a couple weeks out, so it all kind of varies with your recovery. Okay, so D8 goes into becoming intimate again, and make sure you look at that reference in the back on F11, the different positions that are good for you with your new hips and new knees. And also a tidbit with that is taking some pain medication before this activity because it'll keep you more comfortable because it is an increase in activity. So just make sure you look at those positions. On D9, this kind of goes into your blood thinners. So making sure you're just very careful when you're on these blood thinners because you will bruise a lot easier. You'll bleed more in case if you cut yourself, so try to avoid that. And then call the surgeon if you have any of those symptoms in the middle of D9. So nosebleeds, bloody urine, excessive bleeding or bruising, all those on that list, that means your blood's getting too thin and you want to let the surgeon know. And next page, D10, that kind of goes into the pain medications again. Making sure even at home, you stay on your pain medications. If you feel your pain increasing and you're okay to have that dose if it's due, make sure you take that. And kind of watching the hours of when you have your home care, if you have that coming in, or outpatient therapy, try to arrange that so you can pre-medicate before those therapy sessions. On D11, protecting your joint from infection. Now this is very important. The surgeons want you to have your dentist appointments, even cleanings, done a month before your surgery date because they want anything in your mouth healed up before getting an incision. Because anything with your mouth, gums, that goes directly into your bloodstream. And after surgery, they want you to wait 3 months before you go to the dentist. And that's because now they want your joints healed before getting your mouth work done. And of course, if you have a tooth abscess or any emergency like that, then you need to get in because you already have an infection happening. After your joint is replaced, you do need to be on antibiotics for lifetime before any dentist appointment or any other invasive procedure. So let either the Who's ever doing your dentist or the other invasive procedure, let them know. They can order the antibiotics that you need. Let your dentist know. If they are not sure on what to order, call back to the ortho clinic. They can call in your prescription. It's usually 4 pills an hour before your dentist cleaning or appointment, and of course the other invasive procedures that you may have. And if you do have any questions or concerns, call back to the ortho clinic. Another common question in the middle of D11 is security checkpoints. So people are wondering, how do I get through the airports without setting off buzzers and sending security? When you go through those x-rays now, they can see that you do have a new joint, but you can get a card from the clinic. So either call there at your next appointment, get the card that says you do have a new total joint. So that'll hopefully stop the buzzers and security running after you.